I'm Amy Armstrong. I'm the clinical director of Meta.
Sure. I'm Katie Heimer. I'm the director of education and outreach at Meta.
Meta was founded probably about 15 years ago. It started in sort of a basement where one woman sort of realized there's a big need in the community for a lot of people who have eating disorders or eating disorder symptoms, and there really weren't a lot of agencies at the time that would really address needs of that community. So she started in the basement, started taking phone calls, started advertising, and then realized that it just sort of started booming from there. A lot of people were really in need. So she started to reach out to the community more, and what we were able to do in a great way, we had a lot of volunteers, a lot of people who came forward who had recovered from eating disorders, who were able to sort of start to really support the organization. Eventually we got a donated house, and then we're able to move to this whole place for a nonprofit. That's a really big deal.
A main component of my job is going out and doing presentations in schools. Not so much like this presentation is a little bit different, but in general we would go out and do just educational presentations. I don't have the clinical background, so Amy would do a lot of the clinical presentations about, for more highly trained groups. But I would go out and speak to students. We do middle schools, high schools, and colleges. And just general informational. We have a variety of different workshops that we do. Some of them more specific and some of them more general.
When I've gone out in the community, a lot of what I do are trainings with people on how to sort of detect eating disorders. I try to gear it towards every specific community that we work with. So primary prevention, so it's an intervention given to the entire population when they are not in a condition of no need or distress. The goal is to lower the rate of new cases from a public health perspective to reduce incidence of disorders. Primary prevention intervenes to reduce potentially harmful circumstances before they have a chance to create difficulty.
We try to strike the balance between educating, but at the same time not, educating in the wrong ways. And we focus on recovery, the fact that recovery is possible for us, so sort of a hopeful message. But also sort of prevention tips, how to help others, how to help yourself ahead of time or during the process of development of symptoms.
So I was curious, eating disorders are definitely intrinsic with American society, they're directly connected. So what do you guys, and society is based on norms and values, right? So what are you guys doing to change the norms and values of society? So,
some of the things that she was talking about that are maybe one step removed from directly being related to eating disorders, but, that they can influence people's likelihood of developing eating disorders. My background is in media, so media is one thing, that we would focus on is, not that we know that we aren't going to be able to change the mass media culture, but we can change the way that people are consumers of that. So that's, those kind of things, like teaching people how to be educated consumers of media, how to see messages that are distorted and recognize them and not allow them to influence their feelings. Just those kind of interventions into looking at the world in a different way. We know that, our organization can't change the entire structure of our society, but we can change the way people respond to it.
So secondary prevention, this is an intervention given to populations showing early signs of a disorder or difficulty. Another term for this is early intervention. It may draw in people a little bit more if you're working in that community. Yeah.
I was wondering, is your overall goal to have the population be healthy, or is your overall goal for people to be comfortable with it?
Both, actually. I think that's a great, those are good. If you look at our mission statement, a lot of it is the prevention and treatment of eating disorders, but deeper into that, there's actually, that's sort of the goal too, is really to have a healthy relationship with your body.